The UK MND Research Institute is a network of centres across the UK that are accelerating the search for a cure for motor neuron disease. They're doing this by pulling together the leading researchers in a coordinated way. The Institute was launched in 2023 and grew out of the United to End MND campaign, which lobbied the government for £50 million to accelerate the search for a cure for motor neuron disease. The Institute isn't a physical building, it's a network of research centres across the country. That means that we can coordinate using the infrastructure that already exists and take the strengths of each centre and pull them together into a whole. The Institute is different from what we already have because it coordinates more than 20 different research institutes, bringing together the strengths of each one into a single whole. And that will help us accelerate the search for a cure and really bring true hope to patients.
Patients have been involved in the UK MND RI from the start. It was in fact their idea. They wanted us to come together as a research and clinical community to change the conversation that doctors were having with patients when they were telling them that they had motor neuron disease. They wanted that conversation to be more about treatment and what could be done to improve the lives of people living with motor neuron disease. The work that we propose within UK MND RI is essential. At the moment, there is no cure for motor neuron disease, and half of people diagnosed with motor neuron disease will die within 2 years. The treatments that we have at best slow down motor neuron disease slightly. We need to do better. We need to be able to change the conversation we're having with our patients when we tell them that they have motor neuron disease.
Until very recently, I've never had more than one trial to offer my patients at any one time, often none. Whereas at the moment we've got 6 and there are more in the pipeline. And that change is because of these huge advances and the understanding that we're getting. Well, the projects we're doing all fall into 3 broad groups. The first is to understand the patient, what's happening to cause motor neuron disease in the person. By understanding that, we'll be able to then move to the second part, which is to develop new therapies that can be tested, and those are tested in the laboratory first. And then that takes us to the third part, where we actually trial the most promising ones of those in patients, so we actually have clinical trials. And from there, that's the step that will lead to an effective therapy.
Patients are an integral part of the leadership team within UK MND RI. 3 people living with motor neuron disease are part of our executive team. Working with patients is essential as we grow. It's important that we listen to the patient voice, and that voice is shaping how we're conducting the activities throughout UK MND RI, but also in shaping the individual programs that are taking place. We want to make sure that the research that we are doing within UK MND RI is important and meaningful to patients. There are a number of projects already up and running within UK MND RI, and the numbers are only going to grow as we attract more funding and more collaborators into the partnership.